Today's topic is preventing winter sickness through the Integrative Siddha Medicine. It is influenza flu, commonly known as the flu. Good evening to all the members, friends, joined from the USA, and good morning to one and all to India, friends from India and Malaysia. So, in the series of webinar, today is the third series. Today we are going to cover the flu or influenza. Flu, also called influenza, is an infection of the nose, throat, and lungs. That is the upper part of the respiratory tract. The flu is caused by virus. Most people within the flu get better on their own, but sometimes flu and its complications can be dangerous. To protect against the seasonal flu, we are all aware of an annual flu shot. Although the vaccines is not 100% effective, there are some other non-pharmacological approaches, non-pharmacological Siddha integrative approaches to prevent and manage the symptoms of the flu. So you all well known about how is it spread. Viruses is usually spread from the person to person through the air when infected person sneezes or coughs. But the virus can also live in a short time on the objects like doorknobs, pencils, utensils, eating cups, phones, keyboards, and other objects. So we can also get flu by touching something that has been recently handled or touched by some infected person with the virus, and then touching our own mouth, nose, and eyes can spread the infection. This is the mode of the spread. These are all some factors affecting the prevalence of the incidence of virus, incidence of the infection. The first important thing is the age. Adult more than 65 years old and children under 5, especially under 2, are at the great risk. A health condition, people with chronic conditions like asthma, respiratory infections, recurrent respiratory tract infection, heart disease, long-term diabetes, and long-term kidney conditions like insufficient kidney function or kidney disease are at high risk. The next one is the immune system. People with immunocompromised condition, weakened immune system due to the chronic diseases like HIV, AIDS, chronic uncontrolled diabetes mellitus, chronic asthma, chronic rheumatoid arthritis, and medications like chemotherapy and that is steroids are at high risk. The low temperature can increase the risk of the spreading the disease or at a high risk. Humidity, humid weather can also increase the risk of the this condition. So these are all the common symptoms. You all well known about these conditions, the symptoms. Each person may have different symptoms. The respiratory diseases symptoms is common for all, but it can affect the whole body. It is common for the respiratory symptoms, but it affects all the organs of our body. The common symptoms are cough with severe breathing difficulty, extreme exhaustion, fatigue for several weeks, headache, high fever, runny or stuffy nose, there is a nasal congestion, severe body ache, sneezing, sometimes sore throat, vomiting, and diarrhea is not uncommon in these conditions. In these symptoms, fever and body aches often last 3 to 7 days, but cough and body ache, fatigability last for 2 to 3 weeks. These are all the common base for influenza. So today's special topic is HMPV. That is a frequently asked questions. We are going to cover FAQs. These are all the questions. The first question is the why are we include this topic today? So you all well known about the media, well connected with the media. China is currently dealing with an outbreak of HMPV, that is human metapneumovirus, HMPV. And videos on social media shows that the overcrowded hospitals and overburdened healthcare systems. So health experts have raised concern about the HMPV in other parts of the world. According to the report published in media, the latest cases include HMPV. A pathogen shows the upward movement, that is the upward trend among the people under the 14, especially in the northern area of China. The second question, the important question is has WHO declared an emergency? No, the answer is no. Even though the report and the social media post describes the crisis, Chinese authorities and the WHO authorities have not declared the state of emergency yet. The flow of infection is being examined, especially since it is coincides with the other infections, respiratory infections in the winter season. The time when respiratory illness typically increasing in trend. As per the reports, the HMPV is spreading rapidly along with the multiple other infections like other flus. The next important question is what is HMPV? According to the US Center for Disease Control and Prevention, it was discovered in 2001. It is not new. It is discovered in 2001. The HMPV is a RNA virus. It belongs to the same family of RSV. That is a respiratory syncytial virus, RSV. It is typically caused upper and lower respiratory tract infection, presenting symptoms similar to the common cold and flu. It also affects the individuals across the all age group with higher incidence in the younger generation. There is a young children and elderly, those who with immunocompromised immune status. These are all the some fundamental things about this question. So again, the mode of spread. What does HMPV spread? Like other flus, HMPV is spread by the droplet infections. That is a cough and a sneeze. According to the CDC, HMPV spreads during the late winter and spring. The next question is what are all the symptoms of HMPV? According to the CDC, symptoms commonly associated with this new virus, that is this challenging virus, is cough, runny nose, nasal congestion and chest congestion, fever, sore throat, wheezing in some severe cases, shortness of breath. The complications are lower respiratory tract infection like bronchitis and bronchopneumonia, and long-term complication is the asthma. So the next question is who is at risk? Like other flu, children under 5 years and immunocompromised conditions like other disease like respiratory tract infection, asthma, and COPD, that is a chronic obstructive pulmonary disease, are at high risk. Is there any current remedy or specific prevention method is for this condition? There is no specific vaccines or current specific preventive methods are available in the current biomedical system. So even though there is no specific treatment, attention should be paid to improving the immune status of each and every individual. So at this juncture, I would like to share the disclaimer This is not a substitution for the current recommendation. Please follow the updated recommendation from the Center for Disease Control, World Health Organization, and local health authorities. Currently, there is no scientific evidence to suggest Siddha preparation and treatment method can protect against HMPV virus. The prevention methods described here are solely based on the previous experience, previous proven antiviral properties of some Siddha formulations for other viral infections, viral diseases. These are all some preventive methods. So we all know that the various preventive methods mentioned in the modern biomedical system, these are all very well explained in the Siddha system, ancient Siddha literature. The first one is the primordial prevention, that is the prevention of the development of the risk factor. The second one is the primary prevention, manage the risk factors of prevent the onset of the disease. After onset of the disease, there is a secondary prevention come into the picture. That is, the secondary prevention means the early diagnosis and the prompt treatment is come under the secondary prevention, and the tertiary prevention that reduce the complication and disability. So we are going to cover the primordial prevention and the primary prevention and the secondary prevention in this webinar. So we are all well known about the primordial prevention. We discussed in the first series. So managing sleep, yoga, reduce stress, drinking adequate water, drinking nirakaram, that is a cold rice fermented water, avoid white sugar, table salt, refined oil, the fast food, and other incompatible food items. Periodical bowel cleansing method, periodical herbal oil bath, avoid chemical products for the cleaning purpose, the immune boost, homemade preparations, all are come under the primordial preventive methods. These are all some natural immunity boosters. We are going to share some homemade preparations. The first one is the spicy powder. This preparation is mentioned in our website, GCSMR website also. You can visit our website and see the preparations. The combination is very simple. Curry leaves, dry ginger, thymol seed, asafoetida, cumin seed, pepper, and fennel seed. Except the curry leaf, all the other parts, that is dry ginger, thymol seed, perungayam, asafoetida, jeerakam, pepper, fennel seed are take it equal quality, shade dried and powdered in a clean vessel. If all the ingredients are equal part, the total quantity, if it is 100 gram, you mix 200 grams of curry leaf mixed with this combination. This is called a spicy powder. 1 teaspoon of this spicy powder mixed with the buttermilk or hot water, or even mixed with your rice, and take it in a daily basis. It is very good immune booster. It prevents, not only it prevents the flu, it also prevents many GI tract symptoms and anemia also. This is simple chukku coffee in Tamil, dried ginger tea. The combination is very simple: dried ginger, pepper, cumin seed, coriander seed, clove, and cardamom. The first 4 ingredients, that is chukku, milagu, seeragam, dhania, the 4 ingredients equal part, powdered and mixed with adequate quantity of water. For example, one person need half teaspoon of each chukku, milagu, seeragam, and dhania, dry ginger, pepper, cumin seed, and coriander seed, mixed with 200 ml of water. Boil it till the liquid come to the 150 ml. And at the time of filter, we add clove, krambu, and elam, that is a cardamom. And you can add palm jaggery or honey for the taste. Once or twice a day, drinking this ginger tea can prevent many diseases, especially in the winter season, common cold, strep throat, nose cold, and respiratory infection, other respiratory infections. This is very important. Simple homemade preparations. This is also useful for alternate for the a normal coffee and tea. Garlic honey, we already mentioned in our earlier webinars. The simple preparation: grind garlic, adequate garlic, in a grinder or in blender or mixie. Put it on the cotton cloth, roast it in a fire, get the juice. This garlic juice mixed with the equal quantity of honey. This is called garlic honey. So 1 teaspoon mixed with hot water, drink twice a day, is effectively overcome the upper respiratory infection, effectively prevent the flu and the other respiratory disorders, disease conditions. So for the preventive purpose, for the pediatric dosage, that is 1 year to 3 years, 5 drops of this garlic honey mixed with 1 teaspoon of lukewarm water twice a day prevent many respiratory conditions. If more than 5 years child, 5 to 13 years, 1 teaspoon of this garlic honey mixed with a half glass of lukewarm water and drink twice a day will prevent the flu and other respiratory infections. For the adult, we can